Is it going? Okay. Many first breath moms struggle with the cravings and withdrawal symptoms that go with quitting. Are there some coping strategies that you would suggest they try?
Yeah, I mean, there's a lot of things that people can do to help with withdrawal and craving, and I think maybe the most important thing that we can offer, in helping them professionally is, first and foremost, give them a sense of what the time frame is like. Because the reality of it is, even someone who's quitting cold turkey, their withdrawal symptoms are probably going to peak within about 4 to 5 days, and then they start to decline. And within, in most cases, less than 2 weeks, they're either back to what they were like before they quit, or even better in terms of some of the mood symptoms. There are a couple of things that linger on, and I do think it's important to be honest with people up front, both for your own credibility and because we want to give them accurate information. The things that do tend to linger, people may not sleep as well as they're used to for maybe up to a month after they quit. Okay. Certainly people report changes in appetite or even weight gain, although with the first breath population that may be harder to tell. that can actually go on for several months after people quit. And of course cravings can pop up at any time. Now usually they drop off dramatically in terms of how often they happen within the first week or two. But for some folks there's actually sort of a perverse aspect to that. If they'll get past the point where it just feels like it's craving after craving after craving, they start to have stretches of time where they're not even thinking about smoking. And then if a craving pops up, because it's such a contrast, it's actually more bothersome to them. So those are all real good things to convey to people, just so they have an expectation of what the landscape looks like. Along with that, though, it's great to start to identify replacements. A lot of times cravings will come when people were used to going outside to smoke, say, and you take the cigarette out, and sometimes the break, the relaxation disappears, and so it's important to encourage people to build those things in. Again, if they have support in their lives, talk to those people. Maybe they have some great ideas of things that could be rewards for them, which is really nice. And other times, it's just a good thing to get into a different space. Way back in the dark ages, before we had any of the medicines to help people, one thing we used to suggest to folks was, if they'd had a really hard day where they felt like they were just fighting one craving after another, they should go see a movie. Because even back then, theaters were smoke-free. You go in there, there's at least a couple hours, maybe 3 if you're going to see a blockbuster. But there'd be a period of time where they knew they couldn't smoke, they knew no one else was going to be smoking. And these days, it's getting more and more rare that you even see someone in the film who's smoking. So it's like they get a couple hours where the urge generator in their mind just switches off, and it's a really nice break.
Right, and especially in the heat.
Yeah,
it's nice
and a little free air conditioning
That's
to
right.
boot.
That's
so.
right.